Hello, and welcome to our lecture on Chapter 2. In Chapter 2 of our course together, we are going to be exploring the differences between leadership and management. And we'll be discussing how managers are often asked to exhibit leadership qualities. We often expect them to be visionary, to be great planners, to be inclusive. But the skills that make up effective management and effective leadership are different. They're not one and the same. And so we're going to talk about the difference between the two and where we may see a little bit of overlap, but where we have these distinct disciplines of being an effective leader and an effective manager. Leadership itself is the process by which we engage others to move forward towards a common goal. And so if you've taken other classes in the past, you've probably heard very similar definitions. The idea of being unified, motivated, working towards a common goal, which is different from management, where management is the process of accomplishing predetermined objectives through the effective use of human, financial, and technical resources. And so these are very specific tools like budgeting or crafting job descriptions, things that we do effectively towards a purpose. That is management. Now, leadership and management functions come together, they overlap. But when I motivate one of my team members, when I inspire them, that's uniquely different from the work that I do to create a job description for them, to teach them a software or a specific skill, how to update tables in Excel. Those are different. And so it's important that we honor and understand both functions and the value of both. Now, frontline managers in healthcare organizations are often directly supervising individuals who are providing care. Maybe you are a nurse manager, a shift manager, someone working in radiology, designing the schedule and working with the radiology technicians. That's a little bit different working with a radiology technologist than maybe what a middle manager does when they're managing larger teams with multiple levels. And so leadership can happen at any level. But we think about these frontline managers, middle managers, and then, of course, our top level, or what we'll often refer to as our C-suite, our CEO, COO, Chief Operating Officer, CMO, Chief Medical Officer. And, of course, there's many C-suite positions, but those individuals showcase leadership in a slightly different way. And one might argue that your ability to showcase leadership isn't dependent on your position, but the way you'll be called to do it might be. The way that those opportunities present themselves. Now, there are many theories of leadership, some of which our textbook covers, that help us understand how individuals feel motivated and engaged to accomplish goals. And the three broad categories are trait theories, behavioral theories, and contingency theories. And so these are our contemporary theories of leadership, the broad schools of thought, if you will. Now, on our next slide here, you'll see that we have these two categories. We have what we call transactional leadership and transformational leadership. Transactional leadership includes things like contingent rewards. Things like, if I accomplish my goal, I'll get a bonus. Well, someone may lead by creating that transaction, that feeling of this for that via a reward. They may also lead with management by exception, where as long as you're doing a good job, you may not hear from your manager except if there is an issue, and then they actively get involved. Now, there's management by exception that's more active or more passive, but normally when we see that term, I think of passive. There's a lot of managers who manage by exception passively, where you may not hear from them unless there's a problem. That is passive management by exception. Some others are actively trying to improve skills, but they also will step in if there's a mistake or a concern or maybe something positive to congratulate you for. And then we also have what we call our laissez-faire leaders, which are more of our country club leadership style that are more relaxed, not at all engaged, even in a management by exception capacity. They're not even getting involved when there's problems. Those all fall on the transactional leadership side, which is different again from our transformational leadership, where we have this idea of transforming value, of creating value for our customers through inspiration and intellectual stimulation and this idealized viewpoint, this mission and vision for our organization. Transformational leaders are also very concerned with having adaptive leadership and meeting staff and patients where they're at, this individualized connection that's so important for people to feel motivated. So these are kind of the broad schools of thought. Now, there's nothing wrong with motivating your team through rewards, right? Sometimes we need to be transactional, but the idea of being motivated through idealization, through positive visioning and inspiration, that can be very powerful, as we know. Now, going back for just a moment, I said our 3 schools of thought are really trait, right? When we think of what trait is, what makes a good leader, attributes of the person, which is different from how they behave, which is different from contingency, which is different from what folks do in certain situations or situational leadership. So I just want to make sure that you understand there's a lot of different ways to look at what makes someone an effective leader, whether they are more transactional or more transformational. And most of the documentation that you'll see out in the literature and that you'll hear from really great leaders is this idea around transforming their teams, the value they contribute. We want to be more on that side, arguably, than just, okay, what happened? Let's solve this individual problem. No, we want folks motivated beyond an individual transaction, beyond an individual moment of communication. Now, part of being an effective leader is strategic problem solving. And this can be an approach to integrating strategy and leadership into the day-to-day. The idea that if we're setting clear goals and objectives and we're moving forward, we can do so in a regimented, organized way that is still very much led by those open, broad feelings of leadership and inspiration. But we can do so in an organized way that allows us to develop a structure in our organization that sets us up for success. So your textbook lays out these 8 steps for strategic problem solving. And you see this in a lot of the literature. Sometimes it's 5 steps, sometimes it's 12 steps, but these ideas conceptually are everywhere. So when we think about solving problems for our organization, and I'm not talking about an isolated problem on a single day, we're talking about big problems. How do we contribute value? How do we broaden our market share? When you think about making a name for your organization, when you think about contributing value in your community, we start out with defining the problem and setting an objective. Are we trying to solve a specific issue? Are we trying to grow? Are we trying to create some sort of community benefit? What is the goal or objective? Number 2, we want to understand all of the drivers. So we conduct a root cause analysis so that we can understand all of the things that lead to where we're currently at and can set us up for success. We then think about alternatives. Now that we know what the drivers are, now that we know what our issue is pretty holistically, we have to generate alternatives, courses of action, things we might do. And that's step 4. Then in step 5, we compare these alternatives. Quite often we use some sort of matrix, a solution matrix, maybe a POOG matrix. There's a lot of different management tools, but we compare the alternatives to decide the right course of action. And then we select that strategy. We address any limitations, anything we need to do in order to make that strategy effective. We develop and implement it, and we evaluate if it worked. This is strategic problem solving, going all the way from seeing and identifying a problem through the process of really understanding that issue, developing alternatives, vetting those alternatives, implementing a solution, and then evaluating if it worked or not. Now, one component of strategic problem solving is understanding the problem. So in step 1, we have to know how to write an effective problem statement. Now, your textbook says that problem statements need to be short, succinct, direct, and they have to actually get at the real problem, not a symptom of the problem. So for example, something like we need more regular delivery of supplies. We need something. That's a need, not really a problem yet. So we want to focus on the problem. It might be better to say something like stockouts, running out of something, of essential supplies are common in our organization. So we want to focus on the problem, not just the need, not just a solution, because it's easy to say we need more supplies, go get more supplies. What is really happening? Once we understand the problem, then we can look at root causes for that problem and think about solution alternatives. Another example is due to understaffing, nurses are overworked. Sometimes if we have too many layers in our problem, or if we're making assumptions about what the cause might be before we really research it, we can get stuck. So sticking with something like nurses are overworked, then we can say, well, why are they overworked? Is it due to understaffing? And is that understaffing a financial issue? Is it a system issue? What is causing that understaffing? What is causing that overwork? We can dive into that more, but starting out with just a clear, singular problem can be really powerful. Also, when we make it too long, the description, and you'll see this in the third row here, looking at our budgets are too small, we have a rundown building, all these things really come down to revenue. Do we have enough money coming in to cover our costs, our expenses? There's not sufficient revenue to cover costs. We don't have to list every cost to know that. We need to know that the ins versus outs of our revenue cycle aren't quite adding up. And so these are just examples of focusing on really simple written problem statements. Now, once you have the problem statement, you can set a goal or an objective. And remember, an objective is a very specific type of goal, right? It's a further drill down. We can set a specific, measurable, achievable, realistic, and time-bound goal once we know what the problem is that we're trying to address. So we have to know exactly what we're going to do. It has to be specific. It has to be something we can prove when it's done. We can measure our progress towards it, measurable. It has to be in some way achievable. It has to be something when it's done, we know we can check it off. It has to be realistic. Otherwise, what's the point? And of course, we have to have a deadline, so it's time-bound. Now, once we make it through that step, we start thinking about how do we achieve this objective? And that's where we may rank or sort or organize our different solution alternatives. So sometimes we do that in very qualitative, open ways. We think about whether or not something's high, low, or medium likelihood of effectiveness. And sometimes we apply a numerical element. We make it more quantitative so we can create a score. So for example here, we want to increase staff satisfaction, let's say. So we're looking at increasing the number of staff, maybe so that they have more help, increasing pay, or improving supervision. Will those things help with our productivity and eventually our staff satisfaction? What is the productivity impact is really what this matrix is looking at. We may say high, low, medium impact. We may say very good, unclear, fairly good. Every organization uses different words for this, but if we're using a word, the annual expense is high. It's qualitative. We're just talking very categorical, very open, very narrative. And so we may look at the impact, the expense, and the political feasibility with words. Now that's great because it helps us understand it initially, but what do we do with that? Do we just go through and count the highs? How do we make a decision? And so sometimes it's helpful when we can take that information and turn it into a number. And so you'll see here the goal being to spend less money and for something to be more politically feasible. This matrix has taken the impact on productivity and ranked it from 1 to 5. And then the annual expense and political feasibility and time to effect has a ranking 2. So if something is very good as far as the impact on productivity, it's a 5 for impact on productivity. If it's very expensive, though, it's a 1 on expense. A 5 would be more affordable. Political feasibility, if it's incredibly feasible, maybe a very high could be a 5. Not so feasible is a 1, right? So we've ranked these so we can add them together. And the solution alternative, the idea, the potential strategy that's the best, gets the highest score. Now, this works really well if you care and your leadership team cares the same amount or proportion about productivity, expense, political feasibility, and time. If all of those are equally weighted, equally important elements, then this works well. But if we go to the next slide, this slide assumes that maybe your team cares a little bit more about the impact of productivity than they do about annual expense. Or maybe they care a little bit less about political feasibility than what they do about impact of productivity. So this number in the parentheses is the percent weighting, if you will. And so this helps us think about things in an interrelationship and think and prioritize the outcomes that are most important. And in this case, the impact on productivity is likely most important. Now, if you look at the top, the weighting on impact to productivity is 50%. So 50% of our decision is based on whether or not it will impact productivity fairly. And so if the first option, which is increased staff, is a 5, in parentheses is the weighted value is a 2.5. 5 times 50% is 2.5, right? Whereas annual expense is only 20% of the decision, political feasibility is 15%, and time is 15 for a combined weighting of 100%. Realizing again, about half of that is whether or not it will positively impact productivity, because that's the objective of the entire program. So this is an example of a pretty straightforward quantitative weighted solution matrix. I like it. Now, in some cases, you may come up with a winner. If we look here, our winner is improved supervision because of the way that everything is. Oh, and I apologize. Once it's weighted, our winner is increased staff. Without the weighting, if we assumed everything was even, the winner would be improved supervision. But if you look at the weighted value, the highest 3.6 is increased staff. Now, what I was about to say is that in some cases, you may have a winner, increased staff, on the matrix, and your leadership team may still decide not to do that thing. So don't be surprised. This is to aid decision-making, this tool. It's not finite. It doesn't have to be followed all the time, but it's meant to get people talking, thinking through prioritization of different ideas. Now here, we're to implementation of the idea. We have a beautiful, highly simplistic, easy to follow Gantt chart. And this is a plan for improving management and leadership capacity at a hospital level. They've got selection of managers, they've got training, they've got retention plans, all laid out with a visual of boxes for how long each step will take. When we have tasks, we know who's doing that task and when they're doing it, and it forms this grid. This is called a Gantt chart. And it's a wonderful project management tool. You can make these in Microsoft Word, Excel. You can make really sophisticated ones in programs like Microsoft Project and lots of other softwares. Now, once we know what we're doing and we're implementing something, we also have to evaluate. So your textbook doesn't spend a lot of time in that space, but I just want to acknowledge it really quickly how important it is that we make sure what we did was effective and we tweak or edit our processes from there. Now, as far as managing stakeholders, one of the key roles of leadership is learning how to not necessarily please everybody, but balance expectations, operate ethically, and make sure that we're balancing performance, right? Quality of care, cost and access, and that we're doing so in a way where our stakeholders, both internally and externally, feel respected, feel engaged, and they want to be our champions in the community. That's a huge part of what we do. We also want to manage our internal folks. So not just the folks that the community members that we're working with, but our own team. The idea of keeping them motivated towards that goal and inspiring followership. The idea, we don't talk about that enough, I feel like, in health services administration, but being a follower, being someone who can execute a really great idea is a skill. But being able to inspire folks to share that common purpose, to work towards success together, it can be a beautiful thing. And we're more effective if we can motivate individuals to join our team and to join our pursuits. One of the ways that we do that is through influencing organizational culture. And so, first of all, we'll define organizational culture. It's really our deepest level of basic shared assumptions, beliefs, norms. It's who we are and how we function as an organization. And so we do things by developing artifacts. We have processes. We have ways of doing things. How do we approve spending? How do we promote individuals? And if we have pretty defined processes, those are easier to defend and build and scaffold around. If we have very informal processes, no one knows why Tim got promoted, right? That can create some issues. And so we want to have signs of physical, psychological, and social positivity, good things happening in our environment, structures in place to make sure we're operating ethically and we're being inclusive and we're being true to our values. And values by your textbook is defined as what groups and individuals think ought to be. Distinct from what exists, but what we believe in, what we're pushing towards is our values. Now, this is a really high level table that looks at different elements of organizational culture. So we've got basic assumptions and beliefs, values, and then those artifacts. What is proof and evidence? If you say, I value high quality of care, which is the third listed basic assumption, then your value, if you say high quality of care is essential, you value quality of care, then you have clear defined quality metrics. You have a team that meets regularly. You publicly report your data. You have a committee structure that reviews it. You put your money where your mouth is. You care about that. If you believe healthcare is a human right and you believe in equity, then you partner with free clinics. You do outreach in low-income communities. You have your staff volunteering in the community. So it's one of those things where, sometimes we talk about, if someone is doing the right thing, it'll bear fruit. It'll grow. The business will grow if we do our work ethically. If we do the right thing, we expect good outcomes. And this is an example that if we're living towards our values as an organization, and we're supporting one another in that, there should be proof in how we function. And sometimes we're working backwards. We have committees in place and we have clear rules and policies in order to create the culture we want. But they are also evidence of that culture. It's a bi-directional relationship. Now, leadership has a huge impact on performance, especially when you think about how good leadership, believing in what the organization is trying to do, feeling tied and committed to that can lead to quality outcomes because we all feel equally held accountable. Also, staff are more likely to stay in an organization where they trust the leaders. So we see positive staff-related performance. And of course, if we have leaders who are oriented towards the needs of their people, we're going to have better satisfaction with management. So all of these are part of positive leadership performance. Now, when we think about predicting a leader's effectiveness, there are a couple of components that folks consider. So whether or not we think Tim will be an excellent manager may be driven by his traits and characteristics that are evidenced in the way he behaves, his practices, and then if he's placed in the right context or setting. Some of us may be better at working with smaller teams or larger teams. Some of us may have specific skills that are better in a hospital environment versus outpatient. So we have to also be put somewhere where we have some knowledge and some comfort level to be successful. And that's where that context piece comes in. Now, the other piece that I think is really important when we think about leadership is acknowledging the idea of leadership competencies. Now, later on in the course, when we talk about leadership competencies, I am going to share some different examples, but this is kind of just our starting place. You'll also notice there's a posted podcast link, a link to a podcast that I did with Dr. Anthony Stanowski, the CEO of the Council for Accreditation for Healthcare Management Education. And we did a podcast talking about leadership competencies that are most sought after by hiring managers in healthcare. So you might find that interesting. Check that out. But this is just a short list, much shorter than the list we talk about in the podcast and some of the areas we'll talk about later. These are the high-level groups. So we have knowledge about the healthcare industry. We have technical skills, right? When you think about computer skills, and I know the little nitty-gritty details related to strategic planning or human resources, really more niche skills. We have our analytical, conceptual, problem-solving, big picture skills, and then interpersonal and communication skills. So these are all key competency areas that we want to work and improve as we become healthcare leaders. And of course, like I said, we break those down a little bit more on the podcast related to ones that were ranked really high as being desirable for healthcare leaders. Things like, is it important to be good at Excel? Is it important to be good at leading change? Is it important to be good at verbal communication? All of which were ranked very high in our data collection. Now, leadership has a significant role, as I was just saying, in managing change. And so what we do when we're effective leaders is we push folks out of their comfort zone in order to achieve and deliver more value. And so while supportive leadership is critical to success, we also want it to be transformational. We want to create more opportunity. We want to improve quality. We want to do things that weren't done before. And so we have to have both folks in an administrative capacity, like many of us have or will be. I assume you'll work in an administrative leadership role at some point in your career. But also we need folks who are clinical leaders, who have backgrounds in nursing or radiology or therapy, who can lead those teams and work effectively in that space. Now, one of the things that's really important, and the last slide we have for this lecture, is the idea of sustaining leadership. Once we have an effective leader in place, it can be hard to transition. And so quite often it's about creating this shared knowledge through something called succession planning, where we have a leader in place who shares their background, shares their institutional organizational knowledge, but also their experience in general, and mentors individuals so that we know who is going to carry that torch forward afterwards. And so it's not just about replacing an individual, it's about creating this shared knowledge, a repository where we store information and making sure that not just one person has all that information. We also sustain leadership by allowing leaders time for self-care. Leadership roles sometimes come with a lot of professional stress, but also personal stress, right? Maybe you're going to board meetings in the evening and you don't have a lot of flexibility for your family. How do we create a better balance for leaders in health services administration so that they're recognized, they're provided support, and they're provided a little bit of rest? All right, well, I hope this was a helpful lecture. Please check out the Quizlet that's associated and the additional notes. Hopefully those are helpful for you as well. And of course, please reach out to your instructor with any questions. We're always here to help. Thank you.